Hello, my name is Kristi. This is my head and neck assessment for Nursing 346. Before entering the patient's room, I would assure that I had all of the necessary equipment needed for the head and neck exam. Once in the patient's room, I would ensure their privacy and I would shut the door or the curtain. I would wash my hands and perform hand hygiene. I would also then introduce myself and verify the patient's name and date of birth against their ID band and ask any allergies and those typical questions when you enter a patient's room. I'm washing my hands. Hello, my name is Kristi. I'm going to be the nurse that's going to be doing your head and neck assessment this afternoon. Can I verify your name and your date of birth before we get started?
My name is Tristan Fliss. I was born April 7th, 1985.
Okay, thank you, Tristan. First thing I'm going to be doing is examining your head. At this point, what I would be doing is inspecting the head for symmetry, shape. Looking at the hair, would note what color this hair is, whether or not the distribution of hair is even throughout the entire head. I'm also looking at this point at the face to make sure that eyebrows, eyes, mouth, nose are also symmetrical to his head and body type. So at this point, what I'm going to do is just put my hands onto your head. I'm going to be feeling your head for any lumps, bumps, or any tenderness. Are you experiencing any tenderness or pain?
No.
Okay. So I am inspecting the scalp for any lesions or anything like redness or scaling. When inspecting the face, again, looking for symmetry. I am also going to test the cranial nerve number 7, which is the facial nerve. So I'm going to ask Tristan to think of something happy and smile for me and show your teeth. So at this point, I can also inspect the teeth for any debris. Can you think of something sad and grin for me? Frown for me. Alright, and think of something that makes you mad and grimace for me. Okay. When doing that, I'm looking for any facial drooping, anything that's non-symmetrical. At this point, Tristan, his facial motions were symmetrical, and I didn't notice anything out of the ordinary. Next, what I'm going to do is palpate the temporal mandibular joint, and what we're looking for is something that wouldn't be clicking or any tenderness or pain. So I'm just going to place my hands here. Do you feel any pain or tenderness?
No.
Can you open and close your jaw? Okay, no pain or clicking or tenderness, right?
No.
When testing cranial nerve number 5, which is the trigeminal nerve, what you want to do is take something light, like a cotton ball, and I'm going to ask Tristan to tell me when you feel the cotton ball.
Now.
Okay. And here?
Now.
And here?
Now. Now.
So so when doing that, that's something light. So then we want to take a sharp object like a pin or a toothpick, and I'm going to do the same thing and test for pain sensation.
Yes. 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 Yes.
So there's pain. He felt the touch in all 4 quadrants with the pin and as well as the Q-tip. When testing cranial nerve number 11, which is the accessory nerve, I'm going to ask Tristan to meet resistance against my hand when I place it on his cheek and ask him to turn his head to the side. So I do that with one side. Can you turn your head to the left? Okay. And this side. And meet resistance with my hand. Good. So it's testing for the cranial nerve number 11. When examining the eyes, I'm looking for, again, symmetry. I'm looking to see that there's nothing immediate about the eyes that I'm noticing, like swelling or redness, irritation. Next, what I would do is then just check the conjunctiva. I'm going to place my hands under Tristan's eyes and have him look up. I'm going to inspect the, look up for me. Inspect the prepubertal area to make sure that to see that it's pink and uncongested, which it is. I'm going to check the bulbar area, which would be transparent, and the sclera, which would be white. And you'd be able to see some of the blood vessels running through it. So then next I'm going to check visual acuity, and I'm going to do that by having Tristan stand up. We are about 20 feet away from a Snellen chart, and I'm going to ask Tristan to read the third line down for me.
P-L-E.
And can you read the next line down?
I-S-B-E.
Okay. And can you read, what's the last line that you can read?
The very last one.
Okay. And can you cover one eye, please? Be your right eye. Can you read for me the last line that you can see?
A-U-T-I-F-U-L-S.
Okay. And can you uncover that eye and read with the other? The last line that you can read for me.
N-P-L-E-I-S-B-E.
Okay. So I'm gonna have Tristan sit down. From the reading the Snellen chart, Tristan has a 20/20 vision with the results that from reading the Snellen chart at 20 feet away. So what I'm going to do now is test for peripheral vision by using the fishbowl technique, and I'm going to have Tristan turn to his side. Ask him, I'm going to put my hands about 2 feet away from the lateral side of his temporal lobe, and ask him to point when he can see my fingers. Okay. And down below. Okay. What you're testing for there is to make sure that as far as the peripherals, that the fingers raised and they can see my fingers at the same time, and which Tristan was able to do. This tests for the second cranial nerve, which is the optic nerve. Next, what I'm going to have Tristan do is the 6 cardinal eye movements. I'm going to have him follow my finger up for me and maintain your straight head. By having Tristan do that, I am watching his eye movement, making sure that both eyes are symmetric and they're both following at the same time. This test tests the ocular motor cranial nerve, which is the 3rd, the 4th, which is the trochlear, and the 6th, which is the abducens. Next, what I'm going to do is use a pen light to shut the light off, and I'm going to use my pen light to look at Tristan's eyes to see their reaction to light. And what I'm going to do is shine a light coming from the back to the side, checking to see that they are round and reactive to light. And now what I'm going to do is look at the eye that I'm not shining the light in to make sure that that eye constricts as the other with the eye that has the light shined in it, and they both do at the same time. So the checking, using that method is checking for 2 cranial nerves, and one is the optic, and the other is ocular motor, which is eye movement. What I'm going to be doing now is looking at Tristan's ears. I'm going to first inspect them, look for any redness or swelling, anything that I would notice like discharge or earwax come from the ear. And at this point, on an external exam, I don't see any redness or swelling or anything to indicate any inflammation. So what I can do then is take my fingers and palpate for any tenderness. Do you have any tenderness?
No.
Here?
No.
There?
No.
Okay. So there's no tenderness upon palpation. So what I'm going to do is use what you would normally use is an otoscope. Unfortunately, I have a pen light, and that's going to have to do. So look in the ear for anything obstructing my view, any foreign objects, cerumen, and I'm looking to see that the tympanic membrane is a gray pearly color. In adults, what you want to do with an otoscope, you want to get the largest speculum that will be able to fit into their ear, and for adults, you want to pull the ear up, back, and out. And you want to have your otoscope face down and straight to get the best view of the inner ears. So from inspection, again, there's nothing that I'm noticing that's no redness or any irritation. And I would do the same for the other ear. And I'm not finding anything, redness, irritation, discharge from either ear. So what I'm going to do at this point is I'm going to do the hearing test. This hearing test I would first do the whisper test, which I would cover up the opposite ear that I'm not going to be whispering in, and whisper numbers and ask Tristan to repeat them back to me. 4, 3, 7. Can you repeat those numbers back to me?
4, 3, 7.
Okay. And again.
5, 2, 9.
Okay. Now Tristan responded with the correct answers as far as the numbers that I stated. If there would be any deviation in his hearing, we could do further testing, which would then be the Weber or the Rhine test, which the Weber test and the Rhine test both use a tuning fork, which I have a tuning fork app. So what we are going to do is test the tuning fork. You would lightly tap the tuning fork, place it on the front of the head, and ask which side they can hear.
The left.
Can you hear from the right?
I can also hear it from my right.
Did you hear it equally on both sides, or did you hear it more on your left side?
I heard it more on my left-hand side.
Okay. So, being that he heard it more on his left-hand side, we could do the Rhine test, which would take the tuning fork, and you would place it at in the temporal area, and ask them if they could stop hearing the sound.
Yes.
Okay. So then what we could do is if they stop hearing the noise, we can put the tuning fork next to their ear, because sometimes air conduction can be heard longer than the actual noise. And we would do it on the same side.
No longer hear it.
I'm going to be inspecting Tristan's mouth and throat. I'm going to inspect the outside, look for any chapped, cracked lesions, anything that I can notice on the outside. I'm going to ask Tristan to open his mouth and say, ah. Down. Like I don't want to see your tongue. Okay. So I'm looking to see if the uvula stays in the midline, which it did, and that the soft palate rises as he says ah. And can you stick out your tongue for me? So I'm not noticing anything, no like bumps or lesions on the tongue. It seems to be pink and moist. Okay. Can I have you move your tongue to the side? And tongue up. So the mouth seam appears to be moist, pink. There's no lesions or anything that I would find as concerning for this exam. That'd be it. By asking Tristan to open his mouth, say ah, move his tongue. We can also do the gag reflex test with a tongue depressor. This would be checking for the number 9 cranial nerve, which is the glossopharyngeal, and also number 10 would be the vagus. There's non-voluntary and voluntary methods to both cranial nerve number 9 and number 10. Voluntary would be having the patient say ah or cough, and involuntary would be the gag reflex. So now what I was also doing is checking the tongue for any deviations from midline, and I didn't notice anything. That would be hypoglossal, the 12th cranial nerve. And while I was also inspecting the hard palate to make sure that there wasn't anything out of the ordinary. That it seemed to be pink, moist, no lesions or anything on that. Alright, so then what I'm going to do is then move to the examination of his nose. Upon examination, I am checking again to see symmetry, any lesions, any bumps, lumps, or any type of tenderness. Ask if he had any type of tenderness in his nose. Have you had any tenderness recently in your nose area?
No.
Okay. So to check for patency, I'm going to have you close one nostril, and can you breathe in and out for me? Okay, and can you do the same with the other side? Okay. What I'm going to have you do is tilt your head back then for me. I'm going to shine a light in your nose. I'm looking for any deviations in the septum, any lesions, redness, dryness, which I'm not seeing any redness or dryness, and no bleeding. Okay. So upon patency, I would say that both nostrils are patent. There was no trouble with airway coming in and out of the nose. So what I could then do is get an otoscope and do an internal exam of the nares. I would note color and any condition of the nasal passage, no inflammation or any swelling of any type that I noticed upon inspection. What I can do next is test the cranial nerve number 1, which is olfactory, and I would do that by having Tristan close his eyes, hold one nostril, and tell me whether or not that if he could smell something that I'm holding up, like an orange. And if he could, I would ask him then to identify what that item was. And I would do that for the other side as well. So I'm going to be checking Tristan's frontal and maxillary sinuses. Do that by placing my thumbs across the and my fingers on the head and palpate the frontal sinuses and then the maxillary sinuses. And can you tell me, are you having any pain or tenderness?
No.
Okay. So no pain or tenderness, and I'm not noticing any swelling. So I'm going to be examining the neck. First thing I'm going to check for is range of motion. Alright, what I'm going to have you do is tilt your head back and down. Back up to center. Left and right, please. Any pain or tenderness while doing that?
No.
Okay. So then what I'm going to do is palpate the lymph nodes, which is I would be checking the preauricular, which is in front of the ear. And again, I'm checking for any tenderness or pain. Postauricular. The occipital. I'm going to be checking then the tonsillar. mandibular. We have the submandibular, submental, the deep cervical, so when checking the lymph nodes, I'm looking for if I find any the size of them, the shape, the location. I'm also looking for any mobility and consistency in a lymph node, and the tenderness of them if they're having any pain or swelling with the lymph node. What I'm then going to do is check Tristan's trachea. Just make sure that the trachea is midline. Notice any deviations from the midline, which I'm not noticing any there. So then I can check for the thyroid, which, if I have Tristan lean his head back for me, you have your thyroid, cricoid, and then your thyroid. I'm gonna have you. Can you swallow? Okay. So the best way to locate the thyroid, I'm gonna have you take a sip of water. I'm gonna stand behind you. I'm gonna place my fingers on your neck here, and I'm gonna have you swallow for me. Okay. And I'm not noticing any enlargements. I'm not noticing any deviations when palpating the thyroid. The center, everything seems to be symmetrical. So then what I'm going to do is check his carotid arteries. I'm looking for a bounding pulse. And look that they're equal on either side. And what I'm going to do then is auscultate for Tristan has a strong and bounding pulse, both equal on either side, and didn't notice any lumps or bumps when inspecting his neck. Okay, Tristan, are there any other questions that you have for me? We are done with your head and neck exam.
No, I don't have any.
Okay. So after concluding the exam, I would ensure safe surroundings, make sure there's nothing on the floor, and that the patient is in a safe area. I would then wash my hands, exit the room, again closing the curtain or the door to ensure the patient's privacy.